Good morning. My name is Catherine Burzins. I'm a research fellow in the ARC North West Coast Impact team based at the University of Central Lancashire, and I'm also the manager of the Impact Roundtable for Mental Health Research and Implementation, which is what I'm going to be talking about today. We're going to start by hearing about the background to the funding that supports the Mental Health Roundtable from Mark, then look at what an Impact Roundtable is and some learning from the Stroke Roundtable that's already up and running. Then we'll look at the objectives of the Mental Health Roundtable and how they will be delivered primarily through the use of research internships. Then hear from one of our Roundtable co-chairs before I tell you what our next steps are and how you might be able to get involved. So first, I'm going to hand over to Mark, who's going to talk about the background to the funding that has allowed us to set up this Mental Health Roundtable.
Hi, so I'm going to speak briefly about the background to our mental health research and implementation support capacity building infrastructure grant that we got recently in the ARC North West Coast. NIHR had noticed that there was a mismatch between the burden of mental health problems across populations and the amount of research activity in those areas. And particularly in the north of England, this mismatch was quite marked. So they launched a competition last summer for ARCs to bid for up to £750,000 to invest over 3 years to build their capacity in designing and delivering research into mental health and supporting the implementation of research in mental health and evaluating that implementation. So this investment, which we were successful in getting alongside 10 other ARCs of the 15, so 11 of us got it all together, allows us to build capacity in our ability to design and deliver mental health research. We do that by identifying early career researchers, those are people who've completed a doctorate training, to undertake projects and to get support and investment in their time, to be able to take time out often from their clinical work to be able to do that. So this is not for university staff so much as people who have an academic interest who work in our member organisations, and also to support our member organisations when they have a particular research idea that they wish to develop into a research project, a bit like we did in the Partner Priority Programme in CLAHRC, if you remember that. So this is about investing specifically in our internships, in a Partner Priority Programme with a focus on mental health, and in identifying those researchers of the future and putting some support wrapped around them and giving them time to write grant applications and fellowship applications. And obviously, because this is the ARC, we are linking that up with our public advisors who may also apply for this, our co-production systems, and of course with this overarching focus on equity and inequality. So this enables us to enhance the amount of investment we can put in specifically to mental health research. We also, of course, want to work with the new systems in health and social care, the Integrated Care System or Integrated Care Board, and to work with them where we can identify together what the priorities are for mental health research so that we can seek to particularly invest in those topics. Wider than that, all the 4 ARCs in the north got this investment, so that's ourselves in North West Coast, Greater Manchester, Yorkshire and Humber, and North East and North Cumbria, and we agreed before we submitted our bids, and since then we are regularly meeting as directors to discuss how we collaborate across the north to build larger grant applications using that collaboration and that additional strength to compete with London, Oxford, Cambridge, etc. So exciting, you'll hear more about this, and we're attracting this significant inward research grant investment both to our North West Coast and the Northern Arcs as a whole, because we're hoping that come later on in 2024 there will be more funding of this type that we'll be able to bid for. To help us do this, we have pulled together a round table which is chaired by a clinical academic and a social services lead from a local authority, and brings together interested parties to oversee the project and give us that guidance and external gaze. Thank you very much, and I will now pass back to Catherine.
Thank you, Mark. So I'm just going to describe what an Impact Roundtable does, and it primarily brings together a strategic level group of individuals with expertise or experience of a particular interest or health condition, in this case mental health, and provides a forum through which knowledge can be shared across these different stakeholders in order to understand what's happening across the North West Coast in mental health, shape future research and implementation agendas by looking at what's already happening and identifying gaps, reduce duplication of effort and increase collaboration, and generate learning of implementing change at system level. The Mental Health Roundtable follows on from experiences within the Impact team of other roundtables, for example, the Stroke Roundtable. And this slide here shows that in the first year of that roundtable being established, the activities that it undertook. So it identified stroke as a priority, engaged with key stakeholders, decided the format of how the roundtable would be organised, identified a chair, developed terms of reference, co-produced aims and objectives, and secured representation, developed roles for all the members and conducted a HIAT, and then facilitated knowledge exchange to shape the focus and conducted mapping activity to identify gaps. So that's an example of how a roundtable might develop. In terms of identifying stakeholders to participate in an Impact Roundtable, this diagram is useful in showing the different sectors that representation is sought from. So from health and care organisations, from local authorities, local universities, wider NIHR infrastructure, third sector organisations, and of course members of the public. I just want to provide a brief overview of how the Mental Health Roundtable will be managed. So it has two chairs. One is Professor Taj Nathan, who's a forensic psychiatrist, and the other is Ian Crabtree, who is the Director of Adult Services at Lancashire County Council. And their role is to chair the meetings, provide overall direction and oversight, and access to their networks. The roundtable is managed by me, and my role is to carry out operational activity to help it deliver its aims. We work closely with the capacity building team in terms of supporting internships and publicity and recruitment to internships. We have administrative support, and of course we have our participants who attend meetings, again provide direction and oversight and access to their networks. The objectives of the Mental Health Roundtable are to identify promising outline proposals for research in priority areas of need, to enhance ARC infrastructure, to co-produce collaborative high-quality grant applications along with other ARCs and higher education institutions, to support focus projects that enhance mental health care and support, to identify and train more research-skilled workforce sustained by grant applications, to support integrated care systems and providers to use data analysis to target research, and to embed robust implementation for improvement. The key way in which these objectives will be met is through research internships, and we have two different types of these that we are supporting. The first one is known as a knowledge transfer research internship, and this is where a staff member from a service, one of the member organisations, applies with a research idea that they want to explore. They're then interviewed to decide whether their idea meets the roundtable objectives, and if they're successful, they are given day release for 1 year, support of an academic supervisor who has expertise in their area of interest and access to relevant research training. And over the year they would do a research project and present their findings in the form of a short report or a poster, depending on what's appropriate for their study. The second kind of research internship that we're supporting is that aimed at early career researchers in universities. So again, a staff member would apply with a research idea that they want to develop into a grant or fellowship application. They'd be interviewed to decide whether their idea meets the Roundtable criteria. And if successful, they'd be given funding, academic supervision, access to relevant training and support to establish a team if it was a grant application. And timescales will vary depending on the individual circumstances, but the outcome will be a research grant or fellowship application, for example, to the NIHR. Next, we're going to hear from one of the chairs of the Roundtable, who is Professor Taj Nathan, who I spoke to the other day about what he saw as being the opportunities of the Roundtable and the barriers that might need to be overcome.
I think the opportunities that will come from the Roundtable are that it's firstly trying to understand where the areas of strength are. So we know across the Northwest Coast that there are strong areas amongst member organisations and amongst academic groups in relation to undertaking research, but we don't always know the detail about those areas, and we're not sure that there is sufficient connectedness between those areas of strength. So that's one thing that I think is really important, and I think we will achieve is that greater understanding and a greater connectedness. But then in doing that, I think we'll also identify gaps, and gaps that are important that the academic groups, the universities, and that the provider organisations recognise need to be filled because they relate to areas of need. And we do need to remember that what we should be supporting is research that is relevant to those areas of need that are specific to our population. So we will improve that sort of knowledge of what's going on, improve connectedness, so get people sort of having conversations and talking and thinking collaboratively, but we'll also identify gaps. And I think the opportunity is that if we are trying to improve research capacity, and we'll do that in all sorts of ways. So there are internships, but there's also increasing capacity by getting those people who are already interested and also have some time to get involved in this stuff. Well, it's linking them up with people so that they can use that sort of the focus that they have and the interest that they have. So I think it's probably all those things. I mean, it's at an early stage, and we are at a stage where we are trying to do some of that mapping, trying to understand, trying to make those links, but I think it will produce those opportunities in the near future.
Excellent, that was wonderful. What do you think, what do you think are the kind of hurdles that we have to overcome? What are the barriers?
I think, I mean, in my view, the main hurdle is bringing together those with academic expertise together with the providers and producing something which is which those two sort of stakeholders, if I may use that term, find is interesting and relevant to them. And I think sometimes that can be quite tricky because the provision of services and the use of services is really quite complex and it's quite messy. So in the provision of services, and I'm involved in the provision of services, we recognise there's that messiness and that complexity. Sometimes from an academic point of view, there's a tendency, for understandable reasons, to strip away the complexity. So in terms of sampling and in terms of the provision of an intervention, it can be purified to such a degree that it starts not to look like the sorts of things we deliver in practice. So again, it's not to say that there are those sort of there's a need to get the methodology right, but can we try and ensure that the methodology also accounts and retains some of that complexity? And I think that's one of the difficulties, is sort of finding that balance between those two areas, making sure that we don't leave so much complexity in that you can't methodologically undertake a strong, robust study, but equally trying to retain enough of it in so that it looks like what we do in practice.
What some beneficial outcomes from internships might be?
So I mean, I think there are clear beneficial outcomes from internships. So firstly, there is somebody who is and I'm thinking of a clinical example, but it doesn't always have to be clinical. And we need to be aware that this isn't all about clinical, but that's my area. So you may have a clinician who has an inclination to get involved in research and is interested in that, but has never really undertaken anything, never got involved in research properly, and not worked with academics. So it for that individual, it's a fantastic opportunity experience for them. There may be then from that individual wants to pursue something academically, and hopefully that they retain the clinical or the service provision element of what they do, but they also want to undertake research in a bigger way. So they will, in the longer term, contribute to that research capacity. But even if they don't, I think there's something to be gained for the provider organisations where the intern is employed, in that if they don't decide to pursue an academic career or to take on more academic work, I think it enhances their sort of general skills in relation to the existing roles. So I think there's something, again, I'm thinking clinically, there's something about taking a sort of hypothesis testing approach, which is what we do in quantitative research, is actually a good sort of intellectual skill to have in practice, hypothesis testing. So you don't come to a conclusion really early on as to what's going on, and then you act on that initial assumption, even though it may be wrong. You say, OK, well, here's my hypothesis. I think this may be the problem, and we can work on the basis of this, of my formulation of the problem at the moment, but I'm going to keep an open mind that there may be other explanations for this. So I think for the internships, that's an opportunity. Those are the opportunities and the potential benefits. I think what we're hoping is also that the internships and the research capacity will lead on to grant applications and successful grant applications. So big research projects that draw on that capacity that we're enhancing, but also take up the questions. So the questions that the internships will be attempting to address on a smaller scale will take them up and to a much bigger scale. And in terms of the research, in terms of the sample size and in terms of the methodology and in terms of the extent of the collaboration, you can then produce some very convincing and sort of impactful findings.
Thank you, Taj, for sharing your thoughts. So what are our next steps? Well, our first job is to map our existing mental health academic interests across North West Coast. So we'll be getting in touch with mental health researchers at our member universities and asking them what their research interests are and what kind of projects they'd be interested in getting involved with. We'll then be asking services about their priorities. So what kind of research do they want to see? What's useful for them? We'll then compare these two sets of information, looking for overlaps and gaps, and that will help guide our decision making going forward. So please do look out for these requests and tell us about your interests. Also in time, we'll be advertising our internships. So if you know anybody that might be interested, then please do encourage them to apply. So thank you for listening, and I look forward to updating everybody about our progress over the coming months. Thanks very much.